Why is there blood in your urine? Hematuria Explained. Imagine seeing a pink or reddish tint in your urine and wondering what's going on. Blood in the urine, known as hematuria, is a sign that something is affecting your urinary system. It can be visible to the naked eye, which is called gross hematuria, or only detectable under a microscope, known as microscopic hematuria. Even a small amount of blood can change the color of your urine, and sometimes there are no symptoms at all. Hematuria happens because red blood cells leak into the urine from somewhere along the urinary tract, which includes your kidneys, the tubes connecting your kidneys to your bladder itself, the tube that carries urine out of your body called the urethra, and in men, the prostate gland. There are many reasons why blood might appear in your urine. Some causes are harmless, like eating beets or berries, which can temporarily turn urine red without any health concern. Vigorous exercise or sexual activity can also sometimes cause minor bleeding that shows up as blood in urine. Infections such as urinary tract infections can inflame parts of the urinary system, leading to bleeding. Inflammation or injury from trauma to the kidneys, bladder, or urethra can also cause blood to appear. Kidney or bladder stones can irritate the lining of these organs, resulting in bleeding. An enlarged prostate in men, known as benign prostatic hyperplasia, can sometimes cause blood in the urine. However, blood in the urine can also be a sign of more serious health issues. Conditions like bladder, kidney, or prostate cancer requiring prompt medical attention. Blood clotting disorders such as hemophilia or blood diseases like sickle cell disease can lead to bleeding in the urinary tract. Certain kidney diseases that affect the filtering units of the kidneys, called glomeruli, may also cause hematuria. Symptoms that often accompany hematuria include pain during urination, frequent or urgent need to urinate, lower back or abdominal pain, and sometimes fever or chills if an infection is involved. But it's important to note that sometimes blood appears in urine without any other symptoms. Because hematuria can be linked to serious conditions, especially in people over the age of 35, it is essential to see a healthcare professional for evaluation. Diagnosis usually involves urine tests to detect blood, imaging studies like ultrasounds or CT scans to look inside the urinary tract, and sometimes a procedure called cystoscopy, where a small camera is inserted into the bladder to examine its interior. Early detection is especially important when it comes to bladder or kidney cancer, as catching these conditions early can significantly improve treatment outcomes. In the context of bladder health, noticing blood in your urine should never be ignored. It's a sign that your body needs medical attention to determine the cause. While many causes are benign and easily treated, others requiring more thorough investigation and management. Remember, every person's situation is unique, so if you see blood in your urine, consult a healthcare professional promptly. They can help identify the underlying cause and guide you toward the appropriate treatment to protect your urinary health and overall well-being.